Welcome to the March issue of Diseases of the Colon and Rectum. Many of you will be getting ready to register for the annual meeting of the American Society of Colon and Rectal Surgeons this June in Cleveland. I wanted to bring your attention to a symposium that Diseases of the Colon and Rectum is having. It's entitled Critical Review of Scientific Manuscripts. It's going to take place on Sunday morning, June 2nd from 8 a.m. to 9:30 a.m. We're going to offer participants the availability to review manuscripts and obtain feedback on their reviews. We hope you'll decide to attend. In addition to this, DCR is going to be offering a session entitled The Best of DCR. This is going to take place on Monday afternoon, June 3rd, from 4 p.m. to 4:45. We hope you attend both these sessions. During February, Journal Club focused on the topic of pilonidal disease. In March, we're moving to the topic of colonoscopy. If you go to our website, dcrjournal.com, you'll notice that on the banner of the journal, on the top of the web page, we have added a tab for Journal Club to make it very easy, or if you're using your smartphone, you can access it quicker that way. Or if you scroll down on the left side of our website, you'll find the Journal Club section just below Residence Corner. And here you'll also find a tab to look at questions to stimulate discussion. Our Residence Corner this month features the topic Adjuvant Chemotherapy for Colon Cancer. It's written by Drs. Hone and Smith. The expert commentary for the Residence Corner is written by Dr. Connell and Surchek. We have 7 editor picks this month. The first of these is entitled Robotic Transanal Minimally Invasive Surgery for the Excision of Rectal Neoplasia, Clinical Experience with 58 Consecutive Patients. This is written by Drs. Tomasi and colleagues from Kaiser Permanente in California. In this article, they discuss their initial experience with robotic transanally minimally invasive surgery on a variety of patients, including everything from rectal cancer, carcinoid, GI stromal tumors, as well as polyps. A very interesting read. Next, our second editor pick is entitled The Influence of Anastomotic Leak After Elective Colorectal Cancer Resection on Survival and Local Recurrence, a Propensity Score Analysis. This is written by Dr. Zimmerman and colleagues from Lübeck and Heide, Germany. In this study, the authors looked at a very large cohort of over 1,000 patients undergoing colorectal cancer resection and specifically targeted 94 patients who had anastomotic leak and used propensity score analysis where they had an equal number of patients that were matched. And here, interestingly, they found that there were no significant differences between the groups in terms of overall survival, disease-free survival, and local recurrence rate. Our third editor pick is entitled Profile of Consecutive Fecal Calprotectin Levels in the Perioperative Period and Its Predictive Capacity for Early Endoscopic Recurrence in Crohn's Disease, and this is by Dr. Liu and colleagues from Nanjing, China. In this study, the authors wanted to determine if fecal calprotectin could predict early postoperative endoscopic recurrence in Crohn's disease in patients undergoing intestinal resection. They examined over 100 consecutive patients undergoing resection, and they interestingly found that the change in fecal calprotectin from preoperative day 14 to postoperative day 14 was opposite in those patients who developed endoscopic recurrence versus those who did not. Our fourth editor pick is entitled Persistent Fistula After Anal Rectal Abscess and Abscess Drainage, Local Experience of 11 Years, and this is by Dr. Sanan and colleagues from the St. Mark's Hospital and Academic Institute in Harrow, UK. And in this study, the authors looked at a very large cohort of nearly 2,000 patients and found that fistulas occurred in 16% of patients, and that patients with Crohn's disease were more than twice as likely to develop fistulas, and the Crohn's patients with a fistula were more likely to be women and more likely to be less than 30 years old. And in a multivariable analysis of the entire cohort, male gender and patients with diabetes mellitus were associated with a reduced likelihood of developing a fistula after abscess formation. Our fifth editor pick is entitled Hemorrhoidal Disease Symptom Score and Short Health Scale HD, New Tools to Evaluate Symptoms and Health-Related Quality of Life in Hemorrhoidal Disease. And this is by Dr. Rohrvik and colleagues from Denmark. In this study, the authors wanted to assess the validity, reliability, and responsiveness of a symptom score of patient-reported pain, itching, bleeding, soiling, and prolapse. In addition, they wanted to assess the reliability and responsiveness of an instrument to evaluate health-related quality of life in patients with hemorrhoidal disease. So a very important study for evaluating these patients. Our sixth editor pick is entitled Female Representation and Implicit Gender Bias at the 2017 American Society of Colon Rectal Surgeons Annual Scientific and Tripartite Meeting by Dr. Davids and colleagues. And in this study, it is accompanied by a very interesting editorial entitled Moving Beyond Representation as a Marker of Gender Equity. And the editorial is written by Drs. McKinley, Roberts, and Ricciardi. I encourage you to read both of these, are very interesting. The article itself wanted to evaluate the representation of women at the 2017 annual meeting and assess for implicit gender bias. And in their paper, they found that there was a difference on how introductions were made, whether or not there were female or male moderators. So again, a very interesting read. Our last editor pick, for which CME is also available, and this is a current status article, is entitled Meta-Analyses of Current Strategies to Treat Uncomplicated Diverticulitis. And this is by Dr. Meggy and colleagues, Dr. Meggy and Yao from the Department of Surgery at Weill Medical College of Cornell University. And in this study, the authors performed a meta-analysis of different management strategies for uncomplicated diverticulitis. And this actually included two different meta-analyses. And here they concluded that there was no significant difference between observational management and antibiotics in terms of emergency surgery and recurrence. But if they considered only randomized trials, elective surgery during the follow-up occurred more frequently in the observational group than the antibiotic group. And in their second meta-analysis, they showed that failure and recurrence rates were similar between oral and intravenous antibiotic treatment. We have a lot of very interesting content in the issue, and we hope to see you again next month. Thank you.